All right. We carried out my economic vision to move from trickle-down economics to what everyone on Wall Street Journal, from the Wall Street Journal, Financial Times is calling Bidenomics. It's about growing the economy from the middle out and the bottom up, and because when that happens, the folks in the bottom have a shot. They get a chance to raise up, and the wealthy still do very well. It's not to hurt anyone at all. But today's job shows that, jobs report, shows that Bidenomics is working. We added 200,000 jobs, to 209,000 jobs last month. And all told, we've created over 13 million. In 2.5 years, that's more than any president ever created in a 4-year term. And folks, the unemployment rate is below 4% for 17 straight months. Not since 1960 has that occurred. Inflation continues to fall. It's less than half of what it was a year ago. And the rate of Americans without health insurance is at an all-time low. Premiums for coverage. Premiums for coverage of the Affordable Care Act are $800 less per person than before I took office. And that's Bidenomics. Today, I'm joined by healthcare advocates and leaders. Many of them, if I started to name you all, we'd be here all night. But I want to talk about key parts of my economic plan. We're protecting consumers and reducing healthcare costs without in any way hurting insurance companies, docs, hospitals, or anybody else. You know, in my State of the Union address, I outlined our fight to end junk fees and hidden charges for companies who sneak into your bills things that you don't think you're going to pay for. Each year, those junk fees cost hundreds of dollars a month for tens of billions of dollars, weighing on down family budgets and making it harder for people to pay their bills. Junk fees may not matter to the very wealthy, and it's not the wealthy's fault, by the way, but they matter to working folks in homes like the ones I grew up in. Over the past few months, my administration has cracked down on junk fees across different industries: banking, hotels, concerts, tickets, airlines, cable, internet, and the internet.
Good afternoon, friends. This is very important for the American people. President Biden has just made a big announcement. The Biden administration is now vowing to help consumers save money on healthcare costs. Experts say that many U.S. households will save hundreds of dollars thanks to Biden's new release plan. My dear friends, please make sure that you watch until the end of this video to learn more about this. Also, in a video later today, I will be announcing several winners for the Walmart gift card giveaway. If you'd like to enter the weekly giveaway, friends, all you have to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you watch and then comment on, my dear friends, the greater your chances of winning these weekly giveaways. Now, friends, according to Yahoo News, today President Biden rolled out a new set of initiatives to reduce healthcare costs. It is a crackdown on what he called junk insurance plans. The Biden administration has unveiled new guidance to prevent surprise medical bills and an effort to reduce medical debt tied to credit cards. Biden is building on previous initiatives to limit healthcare costs. The Department of Health and Human Services released new calculations showing 18.7 million older adults and other Medicare beneficiaries will save an estimated $400 per year in prescription cost. This is because of the president placing a cap on out-of-pocket spending as part of last year's Inflation Reduction Act, now gearing up for his 2024 re-election campaign, as inflation remains a dominant concern for many voters. Biden has emphasized his policies to help U.S. families manage their expenses, as well as a spate of government incentives to encourage private sector development of electric vehicles, clean energy, and advanced computer chips. Republican lawmakers have criticized Biden's policies by saying they have spurred higher prices that hurt the well-being of families. Then Biden said his administration was taking aim at what he called junk insurance plans, such as short-term policy that can deny basic coverage, as people transition between employers and still need temporary health care coverage. The new proposed rules aims to close loopholes that allows insurers to offer products that can discriminate based on pre-existing conditions and market coverage to consumers that provides little or no coverage. And today, Biden also announced new guidance on medical billing, stemming from 2020's No Surprises Act. The guidance would limit the ability of insurers that contract with hospitals to claim provided care was not in-network and have customers to pay more money. Health plans also would need to disclose facility fees that are increasingly charged to patients and can surface as an unexpected cost in a medical bill. The Consumer Financial Protection Bureau and U.S. Treasury Department are also seeking information on third-party credit cards and loans that are specifically used to pay for health care. The higher costs and interest charges can discourage individuals in need of treatment from seeking any care. The president, in his remarks, also highlighted previous efforts to reduce healthcare costs, including a plan allowing Medicare to negotiate lower prices for prescription drugs and a $35 monthly price cap on insulin for individuals in Medicare Part B. Social Security is a major source of retirement income for millions of seniors, but not all of them. According to the Social Security Administration, about 3.5% of the U.S. population, ages 60 and older, never receive Social Security benefits. Even a large population of seniors who do qualify for Social Security retirement benefits cannot rely on these payments alone to pay their bills. This is mainly because Social Security checks do not go very far in today's economy. The average Social Security payment for retired workers is $1,825 a month. That is well below the median monthly income of $4,400 for private sector workers. This is based on the latest U.S. Bureau of Labor Statistics data. For someone who worked all their adult life at average earnings and then retired at age 65 in 2022, Social Security benefits replace only about 37% of past earnings. Social Security's replacement rate began to decline as the program's full retirement age gradually rose from 65 years old in the year 2000 to 67 in 2022. The average Social Security check will not go far in terms of paying the bills. A recent report from Rent.com found that the median national rent alone is about $1,995 a month. As recently as 2021, before last year's soaring inflation rate had kicked in, average monthly expenditures for U.S. households were about $5,600. For individuals, average expenditures came to about $3,400 a month. So, dear friends, what should President Biden do to better the U.S. economy? Please let me know what your thoughts are in the comments section below. Well, my awesome and amazing friends, that is the end of my daily stimulus update video for this Friday afternoon. My dearest friends, thank you so very, very much for joining me here and for being part of this community. To say thank you and to show my appreciation, I will be announcing several winners for the $75 Walmart gift card in a video later today. My friends, if you'd like to enter these weekly giveaways, all you have to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, my friends, the greater your chances of winning the giveaways. Thank you and have a wonderful and very blessed Friday.